CPAP versus oxygen in obstructive sleep apnea. Definition: obstructive sleep apnea breathing ups you are big airway, row or partially.
Inflows or wind or travels through a obstruct smaller loops your lungs. Time you in, if suction, the sawtooth in and fares in
trachea,
pulls in your lungs front, when the sawtooth again keeps your open
into your lungs.
You sleep normal muscle mouth and things like but enough to
Each
airway.
time you breathe in, negative
have
suction
sleep
pressure
apples of your
pulls the
pharynx
soft
may reach
tissues
too much
in your mouth and
tongue
pharynx
drawn to the
inward.
tissue roof of mouth, it at the
The
back
muscles
oats.
in your
This
pharynx
complete
respond
flow of
by
into
pulling the
lungs.
soft
The
tissues
oxygen
outward
lungs
again,
you up.
which keeps your
You
airway
ask her
open.
to establish you be falling again.
When you sleep, it's normal for the muscles in your
positive
mouth, tongue, and pharynx to relax slightly, but not enough to block your airway. If you have obstructive sleep apnea, the muscles of your mouth and pharynx may relax too much. Your tongue drops onto the soft tissue in the roof of your mouth, pressing it against the back of your throat. This completely blocks the flow of air into your lungs. The lack of oxygen in your lungs wakes you up. You may gasp for air to re-establish airflow before falling asleep again.
Obstructive sleep is associated with protein infusion, increased vascular.
To sleep. Millions may suffer from apnea USA. It is more adult disease asthma, affecting 4% men, 9% women ages 50 years of age. It is even common in old people and for older than 60 years of age. It is a risk for the death of cardiovascular disease. Studied 80 of differential tension, 50% congestive failure, and 6% of stroke are diagnosed today. Obstructive sleep or OAS, sleep disorder in recurrent sensation breathing, decreased airflow attendance or while sleep. People with OSS may hyper describe episodes wherein them become normally O and O. OAS is due to obstructive sleep syndrome causes relaxing the throttles and alicy structure airway. Use fat air attuned to the air, thus it to no down. Sleep causes the throttles to rest. If the muscles are excessive, the air narrowed or complete closed. If relaxation of the due to drinking alcohols, use of sedant, a deviation in the structure of the airway such as in large tools, and in tongue, tissue, tumor airway, and or in lowered can cause air structure, lead to OSS. Who was loud, has experiences more headache, does not rest asleep, and has a jaw thumping up, begins to have obstructive apnea syndrome. B-level obstructive syndrome. First mild OS, which is difference to phenotypic apnea, while OS is 50 to 30 episodes an hour, and the lung is near OS with more than 30 episodes an hour. Symptoms can be helped with mild obstructive apnea syndrome, heart, loose, and calculated 4 to 6 before eating, voice, sleeping, smoke, and your rather than
30 million Americans may suffer from
device
obstructive sleep
breathing, much
apnea,
as Contreras,
or OSA.
air pressure,
It is more common than adult diabetes and asthma, affecting 24% of men
your
and 9%
generation
of
of
women
humiliation
between
of
the ages
disorder
of
and
30
its all
to 60
treats.
years of age. OSA is even more common in overweight people and persons older than 60 years of age. It is a major risk factor for the development of cardiovascular disease. Studies show that 80% of difficult-to-control hypertension, 50% of congestive heart failure, and 60% of strokes are related to undiagnosed OSA.
Obstructive sleep apnea syndrome, or OSAS, is a sleep disorder involving recurrent episodes of cessation of breathing or decrease in airflow for 10 seconds or more while sleeping. People with OSAS may also experience hypopnea, which is described to be episodes wherein the breathing becomes abnormally slow and shallow. OSAS arises due to an obstruction of the airways. Obstructive sleep apnea syndrome can be caused by obesity, excessive relaxation of the throat muscles, or an abnormality in the structure of the airways. Obesity can produce extra fat in the neck area that can put too much pressure to the airway, thus causing it to narrow down. Sleep causes the throat muscles to relax. If the throat muscles relax excessively, They cause the airway to narrow down or get completely closed. Excessive relaxation of the muscles can be due to drinking alcohol at night, usage of sedatives, and smoking. A deviation in the structure of the airways, such as having enlarged tonsils, an enlarged tongue, excessive tissues or a tumour in the airway, and small or receding lower jaw can cause upper airway obstruction leading to OSAS. A person who snores loudly, has excessive sleepiness, experiences morning headaches, does not feel rested after sleeping, and has a dry mouth after waking up can be considered to have obstructive sleep apnea syndrome. There are 3 levels of obstructive sleep apnea syndrome. First is mild OSAS, which is the occurrence of between 5 to 14 episodes of sleep apnea in an hour, while moderate OSAS is between 15 to 30 episodes an hour, and the last one is severe OSAS, with more than 30 episodes an hour. Simple measures can be done to help relieve mild obstructive sleep apnea syndrome, which are to lose weight, drink alcohol no later than 4 to 6 hours before sleeping, avoid sedatives such as sleeping pills, quit smoking, and sleep on your side rather than on your back. Moderate or severe OSAS can be treated by devices that support breathing, such as continuous positive airway pressure, CPAP, and bilevel positive airway pressure, BIPAP, undergoing surgery, and somnoplasty. Your general practitioner can give you more information about the disorder and its possible treatments.